There has been a 48% increase in patients with dementia in Ontario since 2010. That's according to a recent analysis of OHIP data released by the Ontario Medical Association.
It is billing data, so it probably underrepresents the number of patients that actually have an underlying diagnosis of dementia.
Dr. Andrew Park, president of the Ontario Medical Association, says there are large gaps in care that are contributing to those numbers.
We had a statistic that there was 82,000 home care visits. But in order to support the needs of the patients with dementia, we're estimating that over 2 million are needed. From a system level standpoint, we have 2.3 million Ontarians without a family doctor. That's 2.3 million Ontarians who have the potential to fall through the cracks when it comes to early diagnoses for conditions like dementia.
He says that early detection is critical in terms of mitigating the disease, so being vigilant is key. One of the most common initial signs of dementia is loss of memory, progressing into other neurodegenerative symptoms.
Language, behavior, mood can all masquerade in some way as dementia. Your executive functioning, so the ability to do things like driving.
For Dave Spedding's mother, it began with increased forgetfulness.
Not, forgetting a name or an address like we all do, but mixing up my name and my half-brother's name all the time, leaving the water running in the sink all the time after she was done in the kitchen, leaving burners on. And again, anybody can do that, but this became very patterned and very frequent, and we got concerned about her safety.
Spedding and his sister became their mother's primary caregivers when she was first diagnosed at 79. Now in her late 90s, she's living in a long-term care facility. As a former client and now president of the Alzheimer's Society of Toronto, he says the organization was a critical resource in those early years.
I attended some of the support groups. I attended the education sessions. They're all free. And I think when you're trying to navigate this journey for a person living with dementia, your local Alzheimer's Society is a great resource. It can link you up with those community partnerships.
Spedding says funding such organizations that support caregivers should be built into a larger healthcare strategy for patients with dementia, as families shoulder a large portion of the burden of care. And with an aging population, it's going to get worse. Dr. Park agrees.
We do anticipate going forward that we're going to see continued rise in the percentage of patients that are being diagnosed with dementia. The real push is to ensure that we're starting to have these conversations today, because 5-10 years from now is not the appropriate time to realize that we are in a crisis state. We are highlighting that we are in a crisis state today.
Dilshad Burman, City News.